what do you think about, let's just say like when you was in Chicago? Chicago, parts of Chicago is violent.
Yeah.
Do you think those kids that grow up in those areas have PTSD?
Oh, absolutely.
Who addresses it?
I mean, nobody. I think there's a lack of mental health resources in the south side of Chicago for sure. And then what they do is they build these big immaculate hospitals like Lurie Children's, kind of where I worked at, and you don't even have enough appointments. You allocate your appointments to one demographic, and you leave out all the kids on the south side because they don't have suicidal ideations. They have PTSD. And those PTSD sort of symptoms kind of manifest later on, and it leads to gun violence and all types of other stuff as a way of, it's like a coping mechanism in a way. That's all they know. And so it just propels this sort of mental health crisis in the south side of Chicago, which is very unfortunate. But
So then,
nobody wants to work there either. You put a mental health clinic in the south side of Chicago, nobody wants to take Medicaid kids, which is very sad. Because they know the reimbursements aren't what they're going to be like for private insurances and stuff like that. So, I mean, healthcare is a business for sure, but it comes to a point from an ethical standpoint, a moral standpoint of, you know, are you business focused or are you focused on like morals and values and having a good moral compass? And you, sadly, when it comes to healthcare, I don't think you can have both.
so do you know who, like, let's take the South Side of Chicago and what you're saying. You know who fixed stuff like that in the healthcare and all that? You know who fixed that?
Yeah.
People like y'all.
Yeah.
You go into private practice and you service those areas. We have to fix that.
Yeah.
We do. Because we can't expect anybody else to do it.